After the break on the Daybreak Dish with New Year's resolutions in full swing, it's a popular time of the year for knee injuries. Did you know that? We'll tell you the best ways to prevent knee pain.
From the station that's on your side, this is Channel 7 News Daybreak.
Coming up, we're going to talk with our Baptist health doctor, David Gerson, about preventing knee pain.
The 4 stretches you should perform before exercising coming up next.
6:23 is the time. Welcome back with New Year's resolutions in full swing. Many of us hitting the gym. Baptist Health Dr. David Gerson says he sees a lot of patients this time of the year with knee pain, most often with no specific injury. Dr. Gerson from the Sherwood Family Medical Clinic here to share a few tips to help ease the discomfort that keep you on your goal for a healthier 2016. Unfortunately, knees are an important part of working out.
They are.
And you see a lot of pain.
And it's a poorly designed joint, but it's what we got, so we work with it.
For now, until evolution catches up, hopefully hundreds of years from now. Okay,
hundreds of years.
But for what we have right now and what you see, what are some things that maybe people can do to help ease it or prevent it from happening?
Sure, and I'll start with what isn't necessarily the most obvious thing, but your shoes. A lot of us, unfortunately, have flat feet, have poor arch support, and so I'm going to exaggerate a little bit, but a lot of us walk around kind of with our feet turned in.
Really?
And this causes a pretty significant angle and pressure on the knee joint. This ends up happening is we end up overdeveloping our lateral muscles on the outside, underdeveloping our medial muscles, and we start pulling this patella, we start tracking it outside, and that causes a runner's knee. And so typically we'll have pain kind of under the kneecap, throughout the knee, but it can appear anywhere. But this is the thing I see the most in folks where it's not an acute injury. It's a runner's knee, it's a patella tracking, it's tracking laterally, it starts with the feet. And so having your shoes, when you're buying those shoes, make sure that those toes are pointing forward and your knees are pointing forward. Okay? The other big deal is people just don't stretch. They want to hit the ground running.
Yeah.
And that is, if you don't warm up, that's where you're going to get an injury as well. So you want to do a quadriceps stretch. It's a very simple stretch. Just grab a piece of equipment, grab that ankle, pull that back nice and gently, count to 10 Mississippi, breathe nice and easy, stretch it out, and I like to do 3 sets both sides.
Oh, really? Okay.
Hamstring stretch, you just take that leg, let's see if I can do my gymnastics, bringing it up here, just kind of gently coming down. You don't have to, you're not making a contest here, you don't have to grab the foot, you're just trying to stretch out.
That's a good one.
The hamstrings as well.
Oh, yeah.
And then patella mobility, while you're in that position, push that patella down, push it up, try to stretch that out a little bit. Okay? Yeah, I understand.
Yeah.
It's a little tough.
Just seeing it move,
Well, because of your history, right?
Yeah, well, if you've ever dislocated your knee before, it makes you cringe just thinking about it, right?
Very unnatural feeling.
Yes.
One thing I'll also tell patients to do, and I know it sounds funny, we have to focus on these quads. That's these quad muscles here. This is what helps protect this knee.
Okay.
And the exercises, there are quad strengthening exercises. You see the weight benches. You see the slides that you're pushing up on. I know it sounds funny, but find a track or find a flat area and walk backwards. Actually walking backwards for 10 or 15 minutes, you'll feel it. It helps fire those medial quads, helps strengthen this side of the knee, brings that kneecap back in, and it's really gonna save you the potential for injury.
Some nice exercises that you can do to stay on track for a good 2016. Dr. Gerson, thanks for coming in this morning as always. You can call the Baptist Health Helpline at 1-888-BAPTIST.